Vitamin D deficiency in captive adult Asian elephants. In northern climates, adult Asian elephants have been shown to have a vitamin D deficiency. Not a whole lot is known about elephants' needs when it comes to vitamins and minerals, but it is assumed that elephants receive their vitamin D from cutaneous absorption. In northern climates, they do not receive the same amount of sunshine as in their natural Asian habitats. This creates a vitamin D and calcium metabolic imbalance. Lack of vitamin D will create a lack of calcium due to the inability of the body to absorb and utilize the calcium. Most symptoms of a vitamin D deficiency are also symptoms of a calcium deficiency. These symptoms in adult captive Asian elephants in northern climates include fibrous osteodystrophy, osteomalacia, and hypocalcemia tetany. Fibrous osteodystrophy causes weakening of bones, swelling of the upper and lower jaw, lameness, difficulty standing, and fractures of bones. Osteomalacia is impaired bone metabolism due to inadequate levels of available phosphate, calcium, and vitamin D, or because of reabsorption of calcium occurring in adult animals. It demineralizes bones, replacing normal lamellar bones with unmineralized lamellar bone. Hypocalcemia tetany is a consequence of severely lowered levels of calcium in the blood. Symptoms include involuntary muscle cramps, spasms, and overactive neurological reflexes. It is assumed to be an issue leading to dystoxia in captive Asian elephants. Asian elephants have not been successful in reproducing in captivity. To combat vitamin D deficiencies in captive Asian elephants in northern climates, the use of supplements is an option. However, naturally, Asian elephants create vitamin D through subcutaneous absorption, so a UV light is also an option, helping the elephant in northern climates produce vitamin D. Vitamin D, in turn, would allow for utilization of calcium, avoiding the effects of low levels of calcium.